potassium, that is kali. Okay, now we will go towards the constitution. Mainly you always remember 4 points regarding causticum. That causticum is indicated in constriction. Any type of a constriction sensation we give causticum. In paralysis cases we give causticum. Mostly left sided, it is a right sided drug, but a left sided paralysis case we can give causticum. And the third point is that it's all the complaints or pains are comes gradually, and last the all the complaints are not cured since born. Okay, so let us start with constitution, that how the person look. So mainly it is a swallow complexion, not like rigid, muscular, robust, but it is a very weak, thin, spheric person. They have shallow complexion. What does it mean? Shallow means deep furrows. Deep furrows whenever he smile or he on forehead he get furrow. Then what is the subject? It is mainly affection is on respiratory and urinary tract. You should remember these things. Then children are mainly light hair, delicate, sensitive. Mainly in there will be during dentition they have the convulsion, eruption of epilepsy or convulsion like thing happen, like sternum and like cupodium. Okay, then patient improve for a time, then comes to standstill. That is the important peculiar point. You should always remember about sternum causticum, that all the remedy if given or it becomes standstill, we can give causticum. And also causticum is the remedy when the remedy vital strength is loss of the patient to stimulate, enhance the vital force. That is the meaning of this, that improve for a time, then comes to standstill. For like soranum sulfur we give mainly intercurrent. Likewise causticum can be given in intercurrent to enhance or stimulate the vital force, so that the patient will act, the medicine will act to the patient. Then mental general, mainly all the elements from grief and sorrow, like phosphoric acid, your grief, all type of syphilis, like auromate. Like grief, sorrow is the most chief causation. Loss of sleep, night watching, like cocculus, ignacia. Sudden emotion, fear, fright, joy, like coffee cruda, gelsimum, your ignacia. All ignacia, every ignacia in acute condition. We give ignacia in acute condition of disease happening. But in chronically, if a long-lasting grief occur, then we can give causticum. Mainly suppressed eruption also there is a causation. Anger, vexation is also causation. Anger, vexation means the vexation is like short temper. The patient is the short temper means so when angry it becomes so violent, like that. Then melancholic mood, always hopeless, care, grief, sorrow, weeping tendency. Least things in child, due to this weeping tendency, least things if not get, then they get cry. Always remember one comparison is always asked, that sympathetic for others or sympathy for intense sympathy for others is causticum. And what about phosphorus also a first grade or a sympathetic drug. It is sympathy for beggars or those who are need for help, they become sympathetic from them. But causticum is a sympathy for all. That is the important comparison you can do in this. So here, from here we know that causticum is mainly given the swallow complexion, having person the vital force decrease, so that in standstill condition we give the causticum to increase the vital force. Then elements from long lasting grief, night watching, everything, vexation, loss of a. But always remember the causticum, the peculiar is that they are intense sympathetic for others. Physically, mainly causticum is given in case of a soreness. In case of a soreness, where it can be present on respiratory tract, throat. Mainly in clinically it is given sore throat. Painless sore throat is calcarecar, but here the causticum there will be soreness is present. Soreness is present, hoarseness is present, we can give causticum. Then at night the easy position, unable to, because of soreness they can't get a easy position to rest. Move constantly, but motion does not give relief. That is the important also point. Then there will be weakness, vital force decrease. That's why there will be faint like sinking sensation is there. Sulfur like standstill condition, if we give causticum it improve for a time, then comes to a, it is mainly a right side drug. And causticum is a, every time you remember causticum is a chilly patient, fast grade chilly. If you know that is a fast chilly patient, if we go excessive chilly, that is a causticum. Like is gelsium, like graphite is there is also ptosis is present. Ptosis means the due to this muscle weakness, due to paralysis of muscle, eye muscle, there will be eyelids got ptosis, means upper eyelid got ptosis, both eyelid if upper, then sepia. Then GI, mainly it is given in case of a GI paralysis or inactiveness because of ineffectual desire like noxibum, it causes constipation. Stools passes better while standing. Standing is the ambulation position, which due to constipation there will be hemorrhoid start, and in hemorrhoid there will be the stool looks like shiny greasy appearance. And in case of children also we can give nocturnal enuresis condition. Urinary system, always remember like secula and pulsatilla, there will be only whenever they do a urine cough or involuntary, when cough which happen, then some urine is comes out because bladder is not so competent to take the urine inside. So dribbling of a urine also occur because of the muscle weakness. There will be menses, there will be only at during daytime like bubista, like your priozot, like your and okay, like that you can remember. Respiratory, there will be cough, soreness in the chest. You always remember the patient told this symptom, always we have to mark that cough with soreness of the chest, inability to sputum, can't expectorate, swallow, and everything is relieved by drinking cold water like cupromet. Okay, like cupromet, there will be drinking cold water is ambulation. And there will be mainly the pain is occur because of cough is occur because of TB or pertussis, mainly at night time. Always remember cough location, some time is on night, sensation as if soreness in the chest with rawness, expectoration is scanty, and ambulation by drinking cold water like cupromet. Causation is pertussis, or also there will be whenever they get cough there will be pain in the hip region also get. Hoarseness and soreness which leads to apnea, aggravation in the morning like your carbobase, evening aggravation is carbobase and phosphorus. Always remember these things. Extremity, if we go towards the extremity, causticum mainly given in case of children like calcareous children, they have slow learning to walk, unsteady and easily falling in little ground. Then always remember these 5 points of tension, 5 rheumatoid arthritis or rheumatic joint or sciatica, that is Amoncam, Simex, Guicum and anatomy is always given in case of rheumatic affection. Rheumatic affection means where the contraction is most important. In construction is the most important peculiar point of causticum. That's why contraction of the flexor and stiffness of the joint is the important point where the patient gets so much tension and the shortening of the muscle can cause. In case of mainly it is given in paralysis of cases of a single part like tongue paralysis, bladder paralysis, face paralysis we can give. Mainly paralysis occurs due to the disturbed functional activity of brain and spinal cord. When there will be a severe mental shock resulting to paralysis. Mainly right-sided paralysis, cold wind, mainly Bell's palsy, you know, trigeminal neuralgia or Bell's palsy, where after exposure of a cold wind long time, you can get the right-sided face get drooping or get palsy, that is called single part palsy. We can give causticum also. In case of a cicatrization, always remember they never since well born. So that bone injury part, if cicatrization get reopen or sore again, then we can give. And always remember, mainly it is given that wart on face. We commonly use causticum on wart on face, but the wart should be large and pedunculated. If we can't get any physical general, like most commonly people use causticum in wart on face. Then modality aggravation, clean fine weather, amelioration damp wet weather. Okay, this much about causticum. Carbobase and petroleum is complementary. In case of causticum is mainly not used before and after phosphorus. Okay, always you can remember here one GI, there will be in rheumatism also brownia, we can comparison brownia and causticum. Brownia, where we can get the pain shortening of the muscle due to contraction, but the brownia is a hot patient and the causticum is a chilly patient. And brownia is all the causation is because of a stiffness. In brownia you can get the stiffness, but in causticum there will be contraction feeling is there. In natromure also you get the tendons, it is a hot patient, as well as a natromure there will be causation is something else. And in rostox there will be damp weather on sleeping on damp basement, it causes the rheumatism. So